We were in the operating room last week at Community General Hospital as an Elbridge woman had a hysterectomy with the Vinci robot. This is Dr. Myron Luthringer operating the device, which allows for a very precise procedure. And joining us now is Dr. Luthringer, the patient, Kelly Wheeler, and the Vinci robot, $1.65 million. So thanks for bringing in your expensive tools here. I want to start with you, Kelly. First, I want to say, hey, thanks for letting us in the operating room.
Sure.
When you have a hysterectomy, it's like, oh, you're going to have a surgery,
Right.
and by the way, we're going to have TV cameras
and everyone's
there.
going to know.
Exactly. So it's been about 10 days.
Yes.
How are you feeling?
Great.
Really?
Great, yes. Very pleasantly surprised with how everything went and how I feel. The monthly pain that I was dealing with before, the recovery was far less than what I've been dealing with for a long time.
Because with a traditional hysterectomy,
Right.
the recovery is like 6 to 8 weeks,
Right,
and you're in the
right,
hospital for
yes.
several days. You went home the same day, didn't you?
The next day.
The next
The
day.
next day, yeah.
Wow.
Yeah, it's been great. And so I'm very, very pleased and glad that the opportunity came about right when I needed to have it. So.
Was it a little strange to think that a robot was going to be part of this
yes,
whole thing?
Yes.
So what made you say, okay, I'll go for it?
I'm all for the advancements in medical, and I want to, just show how well it went and be proof that it's a good thing.
Well, you look terrific,
Thank
and
you.
boy, you're up and around.
Yes.
And thank you so much
Thank you.
for allowing us in there.
Sure.
And Dr. Luthringer, I know you're very excited because you have talked about how this has been traditionally used for male surgery, like prostate surgery, but now
yes.
it's very much usable for not only hysterectomy, but other procedures for women, right?
Right. For women's health care, it's the state-of-the-art now, the most advanced surgical platform that's out there, and we have it in Syracuse now available for women. Most of the hysterectomies that are done, 2/3, are still done with a large open incision, 6 to 8 inches, so hospitalization is 3 to 5 days.
Right.
Recovery, as you said, is 6 to 8 weeks. Now there's an alternative with minimally invasive surgery, and with the Da Vinci S, the gold standard now in the country and in the world. We have this here now at Community General Hospital and in Syracuse.
Now, we
So
should make the
able to
point
offer-
that the robot doesn't do the surgery. You still do the surgery.
Right. The
Yeah.
robot is only an advanced tool that allows my hand movements or the surgeon's hand movements to be carried out inside the abdomen or in the pelvis. Some of the benefits are the robot has a three-dimensional camera. So there's depth perception. So it's almost as if I am miniature and I'm sitting in the pelvis and doing the surgery right there. It's phenomenal what you can see. In addition to that, the instrumentation bends. It has wristed instruments, which I hope to show you here in a little bit, where the traditional or the conventional laparoscopic instruments are all straight. So I think the reason that the patients do so well is they have much less pain afterwards, fewer complications, less bleeding, less risk of infection, and the surgery that that I can do, or any of the surgeons, it's more precise, and it's technically, it just has advanced us that further, and we can do much more complicated cases through a minimally invasive procedure.
All right, well, you brought this gorgeous piece of equipment in here.
Why don't we have you sit down and give it a try?
Really?
Go.
Okay. I'm going to operate now?
You're going to try it. So, first off, this is the console.
Right.
Right, those are the hand movements. We're not going to have you do any feet movements today.
Okay. I
But
saw you in your socks.
Right, by putting your head in there, now you can start moving and manipulating the instruments. Let's see. There you go.
There we go.
Yep.
Oh, my goodness.
All right, and you can see how the instruments bend, and
Right.
they have a 360-degree radius.
What do you want me to do?
Well, try and just move them around, move your hands out a little bit, try and pick up the rings
Oh.
and see,
I got one.
and try and just set it on one of those cones. Now, with traditional laparoscopic instrumentation, you would have great difficulty doing that because it's not three-dimensional,
Whoa.
and there's no depth perception.
Right.
So when we're usually doing conventional laparoscopic surgery, we're standing next to the patient and we're looking at a monitor that's 5-6 feet away from the patient, and you're trying to manipulate everything.
I'm 2 for 2 here.
You're right.
This is fun.
Now don't take my job, Carrie.
I'll operate on Rick's prostate tomorrow. Dr. Luthringer,
Yes.
this is amazing.
Yes.
And so how long did it take you to learn how to do this? Because this is, it's a little bit strange when you're doing
There's
it.
definitely a learning curve. There's a 2-day live animal lab that I spent 8 hours a day just practicing. There was online, there was observations too with multiple surgeons around the country, and then starting and practicing in my own patients. The thing that really has sold me is, yes, I know I can do more complicated surgery and do it better for the patients, but the way the patients have done, I've had patients go home 6-8 hours after hysterectomy. Most of them are back to work within a week. They go home on over-the-counter medicines, Tylenol, Motrin.
So can most women now have a hysterectomy like this, or is it only a certain type of procedure?
I think it's going to be, within 5 years, definitely standard of care in the world.
Right. But what about now?
Right now. Most of the cases are still done open, as I said. There's a few type of cases that are not candidates. I think a patient with ovarian cancer,
Right.
Extensive cervical cancer, those patients are not. But what this allows us to do is those difficult cases, the very big uteruses, big fibroids,
Right.
terrible scarring from endometriosis or previous surgery. This allows us to do these in a minimally invasive way and get the patients back to recovery, back to their family, home for the holidays, quick, and do exactly what they wanted to do or what they weren't able to do before because of their problems.
All right. Well, Dr. Luthringer, thank you so
Thanks
much.
for
I
having
really
us.
appreciate
I
it. Thanks
appreciate
for bringing in the robot. And Kelly, you're a great sport, and I'm glad you're feeling well. Enjoy the holidays.